Hello and welcome, everyone. We're going to give folks a minute or two just to get logged in. We are monitoring the participant list, so we see that people are getting logged in. So we want to give everyone a minute or two before we get our conversation started today. Thank you for joining us for today's edition of the Hard Conversation. We do want to say a huge thank you to each and every one of you for carving out time in your day to join us. And as I mentioned, we'll give everyone maybe another minute so that they can get logged in and settled in, make sure that their audio is on and the volume is up. Thank you again for joining us. Welcome again. If you heard my spiel, I really appreciate each and every one of you for joining us in the virtual space for today's edition of Hard Conversation. Again, a huge welcome to you. I hope that you are doing well wherever you are. My name is Joli Angel Robinson. I'm president and CEO of Housing Forward. Housing Forward is the lead agency. We serve Dallas and Collin County for the homeless response system, and we truly work together with many of our partners, including nonprofit organizations, our cities, and the philanthropic community, to make the experience of homelessness rare, brief, and non-recurring. I am excited to welcome you to the second installment of our 2023 Hard Conversation series. I want to send a huge thank you to those that work in the background that are on our Housing Forward team, that plan and organize and execute every hard conversation. Of course, I got to shout them out by name, even though they probably don't want me to. That's David Gruber and Sarah Craig and Erica. They do an amazing job on the back end. During our Hard Conversation series, we talked to several guests from across the country as we explore the causes and the solutions to homelessness. This year's series is, for the second year in a row, presented by the Ashford Hospitality Trust, and our additional sponsors include Northway Christian Church and Daniel Roby, Chief Executive Officer of Austin Street Center. Many thanks to all of our sponsors for your support of this work. We could not continue to have these important conversations without you. Before I go any further, I have to have like a resounding drum roll and round of applause for my co-host, Rebecca Hickom. She is our Housing Forward Director of the Coordinated Access System. Thank you, Rebecca, for joining us.
Thanks, Joli.
Rebecca is one of our most amazing directors, as all of them are here at Housing Forward. If you listen to our Housing Forward podcast, which I hope that you do, that Housing Forward podcast is known as We Are Neighbors. Rebecca is my wonderful co-host in that space, and she's my co-host for today's Hard Conversation. Incidentally, if you have not subscribed to our We Are Neighbors podcast, please check it out on Spotify, Apple, or wherever you stream your favorite podcast. It's an amazing experience, isn't it, Rebecca? Wouldn't you say so yourself?
Absolutely. Hit that follow button. Join us. Thanks, Joli. I have been looking forward to this conversation for weeks and months, ever since I heard about the topic and who we would have joining us today. Before we continue, I just want to get a little housekeeping out of the way. We're going to be using the Q&A feature to answer your questions today. As time allows, and at the end of our conversation, we'll go through those questions and answer as many as we can. So throughout our discussion, if you will use that feature, it is in the menu bar at the bottom of your screen. Just type those questions in as you have them, and we'll answer as many as we can at the end of our time together. So with that out of the way, let's dive right on in. For this hard conversation, we are featuring a returning guest who first participated in a hard conversation back in 2016. We've got Executive Director of the United States Interagency Council on Homelessness, or USICH, the Honorable Jeff Olivet. Jeff, will be helping us dig into the all-in federal strategic plan to prevent and end homelessness. Leading up to today's conversation, our Housing Forward team has been sharing a few tidbits on our social media about the plan, and we've shared the full plan on our website. And I imagine one of our teammates is going to be sure to add that link to the full plan in the chat for today's hard conversation. Welcome, Jeff.
Thank you. It's great to be with you all.
Yay. We love to dig right in. As many of you have watched before, I have my scratch sheet of paper because sometimes I deviate from our questions and I have things that bubble up. So I see Rebecca has her scratch sheet of paper as well. We're ready. We're into this and ready for this conversation. Again, that you can take a look at the full plan. It's been added to the chat, that all-in plan that we'll be discussing and digging a bit more into today. I'm going to give a little background about Jeff before we get started. And so let's get to it, everyone. Jeff has worked to prevent and end homelessness for more than 25 years in a variety of roles. He worked extensively in the areas of homelessness and housing, health and behavioral health, HIV, education, and organizational development. Jeff, first question to you. Can you just share a little bit more about your career, how your experiences led you to be appointed by President Biden to serve as the executive director of USICH?
Thank you, Joli. I started my work in homelessness as a direct service provider. I was a street outreach worker and a case manager. I was part of a healthcare for the homeless outreach team in Albuquerque, New Mexico. I don't know, that was probably 25 or 30 years ago. Have been involved in running housing programs and building local coalitions and advocacy efforts. I moved into national research, policy, and advocacy work, and have worked with communities all over the country in improving their homelessness response systems. For almost 10 years, I was CEO of C4 Innovations in Boston. It was then called the Center for Social Innovation. And as part of my work there, I was honored to be part of a team called SPARK that was called Supporting Partnerships for Anti-Racist Communities. And we selected 8 cities across the nation to work with on this intersection of structural racism and homelessness. And Dallas was one of those communities. And I worked really closely with Housing Forward. In those days, you all were called MDHA, if I'm remembering right. And
you're right, Metro Dallas Homeless Alliance.
So I had the honor to be in Dallas as part of that work a number of times, and am really familiar with the good work that you all have done there. So I joined the administration almost a year and a half ago, and have really enjoyed getting to know the federal government space. This is it's a new gig for me. I've not in a 30-year career. This is the first time I've worked in government. So kind of seeing what's possible, what some of the challenges and barriers to that are, but figuring out what levers we can pull is pretty exciting work.
Thanks, Jeff. Thanks for telling us a little bit more about yourself. It's exciting to hear that you have some ties to Dallas and you're familiar with what's been happening in our community over the past few years. USICH, it's a federal agency focused on preventing and ending homelessness in America. So it consists of 19 federal agencies, and we know it works across federal, state, and local governments, as well as the private sector. So President Biden named Jeff as executive director of USICH in late January of 2022. Jeff, I'm sure some of our viewers are familiar with USICH, but we might have some that aren't. Can you tell us a little bit about what USICH does and how it affects us on a local level?
We're the only federal agency that's solely dedicated to the mission of ending homelessness in the United States. And as you said, Rebecca, we've got 19 member agencies. So I think many people might be familiar with the work that the Department of Housing and Urban Development does, or Health and Human Services, Veterans Affairs, Department of Labor, Transportation. All of these other agencies touch up against homelessness or work significantly on homelessness. Our job is to point all that in a common direction and in a strategic direction. And so we set and coordinate federal homelessness policy. And then we also work very closely with mayors, with local officials, with continuums of care, with state leaders, to make sure that the work they're doing locally to end homelessness is as aligned as possible with a national strategy. One way we do that is through our senior regional advisors, and our senior regional advisor for Texas is Tamara Wright. And I know you all are connected with her, but just wanted to let your listeners know that Tamara is a great resource as well. And just to say this, kind of fundamentally, we believe that housing should be a human right, and that housing is the fundamental solution to homelessness. We know that it often requires more than housing. Housing is essential, but not always the only piece of the equation. We know there needs to be wraparound supports in place for many people to succeed in that housing. But we kind of start with that point of view that housing is a human right. What can we as the federal government do to begin living into that value?
I love the way you just said that. What can we do to begin living into that value? As I was jotting notes, that's a hashtagable moment, as we say also in this space when we talk about housing being a human right. So, if you're thinking about it, hashtag housing is a human right. We do love Tamara. She's here joining us and watching virtually, Tamara Wright. So really appreciate her support in this space. And I do want to give a reminder to everyone that's watching, all of our participants, the Q&A. Please, if you have any questions as we're having this conversation today with Jeff, please don't hesitate to put those questions there in the chat. Jeff, you talked a little bit about, which I appreciate you kind of teeing up for us, the work that was done with Spark and the Spark report that really has helped us for our continuum of care that does cover Dallas and Collin County, really focus on the role that racism has and the role that racism plays within our system and within housing altogether. We continue to do some of that work through our racial equity work group, which Dr. Woody is a part of. That I'm just blessed to be able to kind of co-facilitate that space. And some of the things that we say, even in that racial equity work group, for our system is when we think about racial equity, not only by our system, so like the outcomes and the people that are experiencing our system, but also within our system. So racial equity kind of through those two different lenses. Those that we have in the work that we do. So you did talk about that work through Spark. There was a moment that's co-presented in a hard conversation with Mark Dones, who is the current CEO of the King County Regional Homelessness Authority, that helped us kick off that work. And again, Spark, SPARC, supporting partnerships for anti-racist communities on racism and homelessness that continues to this day, as I mentioned. It would be more than fair to say that you are a pioneer in bringing the discussion of racism and homelessness to the forefront. Why has that been a focus of your work? And perhaps why does it need to continue to be a focus of your work?
Unless we diagnose homelessness correctly, we're never going to solve it. When I came into this work in the early 90s, there was very little talk of the intersection of racism and homelessness. There had been some stuff in the research literature where you'd sort of see these disproportionately high rates of homelessness for Black households or for Native American households, but it wasn't translating into any real change at the local level or policy at the federal level. And I think what started happening is that a number of us started coalescing around the importance of being able to initiate. I love that this series is called Hard Conversations. We talk often in racial equity work about courageous conversations about race and racism. It's challenging and it's hard and it's uncomfortable for many people to step into really honest conversations about race and racism. In the political climate that we're in right now, those conversations are very charged. They can be very partisan. People can get polarized from each other and talk across each other really, really quickly. But the reality is that people of color are way more likely than white people to become homeless. The latest numbers I've seen from Dallas are that 24% of the general population of Dallas is Black, but 54% of the homeless population is Black. And if we look across the country, whether it's Washington State or Florida or Vermont or rural Massachusetts or Arizona or wherever, Black people and Native American people are dramatically overrepresented in the ranks of those experiencing homelessness. And if we're not able and willing to have a conversation about that, to acknowledge it and to say, what could we do to change that? Now, of course, we want to end homelessness for everyone. That's the ultimate goal. And in the meantime, are there strategies we can employ that really strive to eliminate racial inequities on the way towards housing justice for all? And I know we may talk later about targeted universalism. That's a concept we use in our federal strategic plan, but that's what's behind that, of really how do we create more just and equitable solutions that reduce high rates of homelessness for people of color, even as we're trying to reduce homelessness and end homelessness for all.
Thank you, Jeff. I think that that's a really good place to start to kind of introduce our topic of the conversation today, to remind us that equity is the foundation of the work that we do with ending homelessness. But for today's conversation, the focal point is All In, the federal strategic plan to prevent and end homelessness, which USICH published a few months into Jeff's tenure. As a reminder, that link to the All In plan is in the chat box.
Thank you. Thank you for providing that basis. We're going to dig in a little bit more into that federal strategic plan. You did also highlight, Jeff, which we will talk about a little bit more in the minutes to come. But like equity work is really, if we make the system work effectively for those that are disproportionately or disparately impacted, then we know that we're creating a system that really serves all. So looking forward to kind of digging into that a little bit more. Before we talk specifically about All In and that federal strategic plan, sometimes I think there's also, it will help all of us understand, why does the federal government need a strategic plan to prevent and end homelessness? Some people might say it's more of a local issue, so local folks need to be thinking about a strategic plan, as we all are and are doing. But why does the federal government need to do that as well?
If we don't operate in a coordinated and strategic way, we run the risk of just fragmented responses all over the place. And that can be true at the federal level with how funding streams work. It can be true at the local level with whether you've got good coordination across different programs and different systems and nonprofits and government and faith community and business community. And so at the federal level, across our 19 member agencies, we've got a lot of different funding streams that fund different homelessness programs. HUD funds a lot around housing and shelter and things like that. HHS, Health and Human Services, funds healthcare for the homeless outreach providers and mental health and substance use treatment. The VA supports homeless veterans in exiting homelessness. And if that's not all coordinated under one kind of strategic umbrella, then it's not as effective, and it doesn't have the potential impact that it could otherwise. So the impetus behind creating a federal plan is really aligning all those resources in a strategic direction. Beyond that, we're also required by Congress to produce one. So when the HEART Act was authorized in 2009, that funded a lot of different homeless programs and authorized our agency. We were originally authorized way back in 1987, but the HEART Act really specified that this agency will produce a federal strategic plan and update it every year. And so what happens is every few years, a new administration will come in, a new plan will come out, and then we issue updates to that plan. But the overall goal is to make sure that we're using these precious resources we have as effectively as possible.
You just mentioned that every couple of years, those strategic plans are updated. So that means that there have been previous plans. Have they helped move the work forward? And what about this plan differs from previous plans?
What we've tried to do is take the best of what has come before, carry that forward, but also chart new territory. And I'll talk about what some of that new territory is. But when we look back at the kind of progression of federal strategic plans, we go back to the beginning of 2010 when the first plan came out. It was called Opening Doors. And what that plan did was lay out specific goals by subpopulation. And if you just sort of isolate veteran homelessness as an example, since 2010, we've been able to, as a nation, achieve a 55% reduction in veteran homelessness. And that was no accident. That plan laid out a strategy for it. The various administrations, Democratic and Republican, funded HUD-VASH program, the HUD-VA supportive housing program, supportive services for veteran families, and other programs that have really helped us drive down that number. So we see that as a proof of concept for how it's possible to really drive down the numbers if you can focus on the housing and service interventions that it takes to do that. Now, what we didn't do was solve all homelessness. And, we saw a good downward trend in the number of people experiencing homelessness between 2010 and 2016. That number was going down. Beginning in 2016, it started creeping back up. The curve started going the wrong direction. And by 2020, when the pandemic hit and all of the economic upheaval around that, a lot of us, I'm sure you all were saying this at the local level too, a lot of us were deeply concerned about what would be a tsunami of new homelessness in the context of the pandemic and people losing their jobs and homes. But what happened is that Congress and again, both the Trump administration and the Biden administration put resources into addressing homelessness and housing instability. So there were emergency rental assistance dollars, there were eviction moratoria, there were new emergency housing vouchers to help people exit homelessness. And what those resources did was bend the curve back. So between 2020 and 2022, the numbers remained relatively flat. So they'd gone down 2010 to 2016, started going up 2016 to 2020, and then we were collectively able to flatten that curve. When we released this plan, what we tried to do is rethink the architecture of it. So rather than go by subpopulation, saying we're going to do this for veterans and this for youth and this for families and this for so-called chronically homeless individuals, what we did is say, let's rethink the framework here. Let's take forward the lessons that we learned, take forward the strategies that we're working, but we've got to pair that good work of helping people exit homelessness with a prevention strategy that turns off the faucets of people flowing into homelessness. So when I talk about kind of charting new territory, homelessness prevention is a significant new direction in this federal plan. Another, and we talked about this already, Joli, but the focus on equity and certainly racial equity at the center of that, but also equal access to housing and supports for LGBTQ people, making sure that there's no discrimination against people with disabilities, looking at all of those kind of intersecting experiences and identities and making sure that people who have historically been marginalized are getting the support that they need.
Awesome. Thank you. Again, if you have a question, please put it in the Q&A section. Towards the end of today's conversation, we leave space and time for questions, but keep adding them to the Q&A. Our Housing Forward team is taking a look at it. I literally have my printed all-in report. So I'm going to talk, right? Like, hey, look at us, Rebecca, we're on top of it. I just want to tease out before I ask my next question, like in your letter at the front of the strategic plan, there's like 3 different areas, not only that are bolded, I think, for the effect, but like just the honest, pure nature of what it means. The first one for me was homelessness is not inevitable and it is not unsolvable, right? Love that. We know what the solution to homelessness is. It's not unsolvable. So before we even get into like the strategies laid out, I love that you speak directly to that. The second one that I kind of highlighted was the other bolded section or statement that says the United States of America can end homelessness by fixing public services and systems, not by blaming the individuals and families who have been left behind by failed policies and economic exclusion. That received a double star for me. And then the other one, just right before the last bolded statement, that I really loved, I really appreciated it, because I think we're continuing to see homelessness be an increasingly partisan issue. As you speak to it directly, homelessness is not a partisan issue. Division and finger pointing will not solve the crisis. After 20 some odd years, Jeff, in this space, I'm sure you've seen maybe the ebb and flow of how partisan this issue may be. And I know that this wasn't a question that we talked about, but anything that you would want to illuminate about even, how or why it's such a partisan issue?
I mean, I think we're at a really dangerous point right now in our society in general about how everybody's in their own echo chamber and we can't talk across political difference. And I know you all in Dallas are in a much more conservative state than some people are around the country. But this is true whether you're in California or Alabama, where I'm from originally, or Massachusetts or Washington State, that the partisanship is actually really counterproductive when we're trying to solve problems. It just results in saying what you're doing doesn't work, or what you're thinking is irrelevant, and I'm in the right here. Now, I do believe that there are things that work to end homelessness, and that's where we talk a lot about data and evidence being the foundation for good decision making. And it's hard when you can't even agree on the data and the evidence, right? Where people are just kind of shouting at each other. But I get I'm clear on where I stand politically. I mean, I'm a political appointee by President Biden, but I'm also very pragmatic in how we solve problems. And we've got to find a way to come together across these political differences and agree on what we can agree on, disagree on what we disagree on, but still share the common goal of ending homelessness, and know that there's got to be room for discourse and room for dialogue.
Thank you. Thank you. Very well said. The All-In Plan does call for a 25% reduction in homelessness by January 2025. Here we are in May of 2023. How do we get there?
It's an ambitious goal, as you probably know when you read the plan. The baseline is January 2022, so it's a 3-year arc that we're trying to follow here. And at the federal level, what we've tried to do is continue to invest resources. And so if you look at things like HUD's recent unsheltered and rural grants that are more than $400 million that HUD has put out into dozens of communities around the country, that's a significant infusion of money to address unsheltered homelessness. We're doing a number of other things on the Hill, on Capitol Hill, to try to increase resources. And if you look at that trend over the last couple of years, under the president's leadership, we're seeing larger investments than ever in homelessness and housing in communities. The home ARP dollars that were part of the American Rescue Plan are still just now beginning to really get operationalized. So we see a lot of glimmers of hope there. But we never believe that it's only the federal government that can do this. It's got to include state and local resources. It's got to include philanthropic and corporate resources. And we're beginning to see more of that kind of public and private partnership emerge. We're beginning to see states pass hundreds of millions of dollars in appropriations to address homelessness. That may not be true where you are in Texas, but we're certainly seeing that in Arizona, California, Washington State, Oregon, other places where there's a significant infusion of new resources at the state level. And then what I'm really hoping that we see is greater coordination across public dollars and faith community resources, philanthropic resources, and business community resources. If you can galvanize all of that towards a common goal, pair that with federal resources that we're trying to drive, then we begin to really see meaningful reductions in homelessness. So it's an aspirational goal that's going to require all of us stepping up in a different way to achieve.
You talked just a second ago about the pragmatism of ending homelessness and the need for that bipartisan support. In the letter that introduces the plan, President Biden speaks of the moral obligation to ensure housing for everyone, but also mentions that it's the smart thing to do, the logical thing to do. Why is it important to emphasize both arguments for housing the unhoused, both the moral and the logical and smart thing to do?
I think it's a way to speak to people's heads and hearts all at the same time. None of us want to see homelessness in this country, across the political spectrum, across people's backgrounds, whether it's wherever you're coming from. None of us think that the status quo is okay. And solving homelessness has to be driven, I think, by a humanitarian impulse, that this is a life and death public health crisis. People are dying on our streets, and that is just not okay. It's not acceptable. But if you start really breaking down the cost to society of not solving it, the cost certainly to individuals in terms of health and life and wellness and connection and community, but even just the financial impact of people cycling through emergency rooms and jails and interactions with police and shelters and all of the kind of emergency response stuff that happens when people are not in the safety of a home. This is not a good situation for anybody, not the individual experiencing homelessness, but also not the community as a whole. And when we've got encampments in our cities all over the country that have really grown and gotten more entrenched during the pandemic, it's not a healthy, sustainable situation all the way around. It's not good for anybody. And so the financial cost of it, but also just the desire to create healthier, safer, happier, more connected cities and counties and states. There's a pragmatism to this that I think is hand in hand with the humane motivation to solve it.
Absolutely. Thank you. Very, very well answered and illuminating, to the point that was made. It's a heart thing and it's a head thing, to make sure that we are solving for homelessness here locally and nationally. The All-In Plan speaks about a once-in-a-generation opportunity to prevent and end homelessness. We've also talked about that over the past couple of years, the COVID dollars coming in, right? Unprecedented dollars that were coming into our system and many of our municipalities. What is it that gives us, everyone, this once-in-a-generation opportunity, and how are we doing so far? I don't know if we want to give a letter grade just yet, but what is it that gives us this once-in-a-generation opportunity?
Part of it's the resources that are available. We've been able to put more resources into communities to address homelessness than ever. Some of that comes in the form of state and local fiscal recovery funds, almost $16 billion for more than 2,000 projects around the country to develop and preserve housing and provide emergency housing, rental assistance, the emergency housing vouchers that I talked about earlier, the HUD unsheltered money. I mean, there's a level of resource that, again, in a lot of places we're seeing be matched with state dollars, private dollars, et cetera. So the resources available are kind of one piece of this puzzle, but I think we're also at an inflection point in the life of our nation and the history of our nation about how we take care of one another as human beings. And I'm a little worried about this part because I think I'm seeing a lot of dehumanization of people who are experiencing homelessness. There's always stigma, but even more, when we see Jordan Neely killed on a New York City subway car, a young man who was clearly in crisis, clearly has had a lot of mental health issues and has just not gotten the support that he needs. The fact that he was killed at the hands of fellow riders of the subway is, to me, a tragic indication of how dehumanized we have made one another, and particularly people who are experiencing homelessness and poverty and mental illness and addiction. We got to do better than that. And coming out of the pandemic, I feel like there's a moment of possibility here. And I know there's a kind of like getting back to normal side of not masking and not having to test everywhere you go and things like that. Today's the day that or tomorrow's the day that the public health emergency is lifted. But we still have an emergency around what kind of a society we want to be. I would hesitate to give that a grade right now, Joli, because I don't think we're doing so well at it.
Such an important part, and not something that we can put a plan together for in paper too. Like, that's something that on a personal level we all have to kind of work to change in our lives, in our personal lives. We've had conversations in our community certainly about this, as we have made some changes over the last year to have a more effective homeless response system. We're housing more people than ever exiting homelessness. And the plan acknowledges that even as homeless response systems do that, they help more people than ever exit homelessness. More people are entering homelessness. So how can communities tackle that problem?
Rebecca, it's a really good question. I think, one of the things that gives me the most hope is that in the years I've been doing homelessness work, I've seen us end homelessness multiple times over. If you really think about who becomes homeless, how long they stay homeless, where they exit to. Now, we know that some people don't make it. We know that homelessness is a deadly crisis, that sometimes people die on the street. But we also know that many thousands of people, hundreds of thousands of people exit homelessness successfully every year. And you all see those extraordinary successes day after day. I think many among your viewers and listeners are probably driven by those positive outcomes, the successes that you see all the time. And yet we've not done a good job of turning off the faucet. We've not done a good job of stemming inflow. And unless we figure out those two parts of the equation, scaling up what's working on the housing and services side and preventing homelessness from happening in the first place, if we don't figure out that whole recipe, then we're going to keep having this conversation year after year after year. But what that tells me is that it's possible, because we know that the housing and service solutions are working. So let's keep doing that. Let's protect those successful strategies. Let's keep doing them. Around prevention, what we're pushing communities to do is look at transition points of inflow. Where are people coming from? Because we know that some people are more likely to become homeless than others. And we know, for example, that young people aging out of foster care are a particularly high-risk group. We know that people who have spent time in jail and prison and are now re-entering into society are at a critical moment of transition. We know when people have been in mental health care, in drug and alcohol treatment programs, that those transitions are really critical. If from any of those systems that I just mentioned, foster care, criminal justice, behavioral health treatment programs, if the first step after that is homelessness, bad things are going to happen, right? It's very, very hard to stay sober. It's very hard to treat your mental illness or trauma history. It's really hard to get a job and keep a job or get back in school. All of those things that really help people stabilize and move out of homelessness become exponentially harder once somebody's living in a shelter or a tent or a vehicle or couch surfing. So the question becomes, can we work with those other systems to prevent that from happening, to catch the person prior to the moment of transition, and not 2 weeks before, but maybe months before, to make sure that the housing and resources are in place to not only just make homelessness rare and brief, but to make sure it doesn't even happen at all. And if we do that in the systems that I was just talking about, I'll talk about foster care and criminal justice for a second. Young people aging out of foster care into homelessness nationally are 90% youth of color. About 50% at least are LGBTQ identifying. Similarly with jails and prisons, we know that people of color are overrepresented. We know that people with mental illness are overrepresented. So if we can stem inflow from those systems, from those feeder systems, if you want to think of it like that, that's also a racial equity strategy, because we're going to really critical points of transition where people are likely to become homeless, and they're also disproportionately people of color, and we're trying to create prevention strategies at those key moments. You'd call those kind of efforts that I'm describing targeted prevention. There are also things we can do broadly, like eviction prevention programs and expansion of the child tax credit and other policies that we've been trying to promote at the federal level. If you look at the president's budget this time, there's additional billions of resources for eviction prevention that would kind of take the lessons learned from emergency rental assistance during the pandemic and carry those forward. We're also proposing guaranteed vouchers for youth transitioning from foster care and for extremely low income veterans, essentially creating a universal voucher program for those two populations. So we're trying to resource this stuff at the federal level, but whether or not those parts of the budget make their way through this very challenging budget season that we're in federally, I think there are things you can do locally to get those systems working better together for early identification, early infusion of resources and support, and dedicating vouchers and things like that to those critical moments of transition. That was probably a longer answer than you wanted on that, Rebecca.
I was going to say, I really love the analogy of the faucet, and you talking about where those, I got to thinking about pipes, and in my head, I've really got this analogy playing out with pipes and the bathtub and the faucet, and thinking about all those different systems as different pipes leading into the faucet. I'm gonna have to draw that one out on a whiteboard, Joli.
I love a good whiteboard session, Rebecca. Let's do that. No, Jeff, that was awesome. I mean, you said a phrase, it was probably a couple of questions ago, but I jotted it down. This is truly probably the moment of possibility. Love, 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 love that. Yes, we are seeing an increasing dehumanization of our unhoused neighbors. It's something, that we talk about here within our organization, but locally, just the narrative around who our unhoused neighbors are, the why, and the solve around that, but really trying our best to bring just a little bit of humanity back into the conversation around homelessness. The next question is around expansion of affordable housing. And I'm also going to try to weave in, not that I'm an expert at doing this, but I'm going to try to weave in a couple of questions that I saw in Q&A that's around expansion of affordable housing, right? So our question is around how can we overcome the not in my backyard or the NIMBYism that can many times accompany these new types of project developments, not only from the standpoint of what might we have to do at the local level, the city level, but federally, what can, if anything, can be done around that to kind of combat that? And then kind of what is the effort that USICH can talk about or talk to directly around the expansion of affordable housing? So I did a lot in that one question, Jeff.
Let me talk about the not in my backyard challenge first. I think I'll give credit where credit's due on this one. I'm going to rip this off from David Dworkin with the National Housing Conference. I heard him say the other day, if people are saying not in my backyard, then the question we ask them is, then are you okay with homelessness in your front yard? If you're not going to cite a shelter or a treatment program or an affordable housing development in your neighborhood, then this is the status quo. This is what we get, is homelessness out in the open, unsheltered, really dangerous for the people who are experiencing it and not healthy for the community overall. How you combat that's a harder challenge. I think part of that's public education and destigmatization and just really trying to humanize the issue. But when people are afraid that their property values will decline if you put affordable housing next door, you can share the data that that's not true, but their visceral reaction is still one of resistance. I think it takes courageous mayoral leadership and courageous leadership by other elected officials to create that change, for city councilors to say, yes, in my district, and we're going to figure it out, and we're all going to figure that out. Each of us is going to shoulder part of the responsibility for this solution. You can look to examples like Washington, D.C., which decentralized its family shelter system and took down a very large single family shelter that was at an old hospital and put smaller, much more, I think, beautifully designed and respectful and well-staffed shelters in each of the districts in town, basically. And a couple of those were very hard in the wealthier kind of, I'll just say the wealthier and whiter districts. It was just harder, but they got it done. And that was Mayor Bowser just making sure it got done. And and working with city council and working with neighborhood associations and everything else just to make that work. And they finally did, not without challenges. But what that's done is help them create a much more effective family shelter system, where they reduced length of shelter stay from almost a year down to less than 90 days, and are getting people much more connected to housing because you're doing it on a kind of smaller scale. Now that's on the shelter side. On the housing side, I think we need mayors and city councilors to really rethink zoning restrictions that make it difficult to develop new affordable housing. One thing we're doing at the federal level is that the White House released a housing supply action plan that includes a number of things. One is rewarding local jurisdictions for reforming zoning and land use, making it easier to develop housing. We're looking at ways to expand and improve existing federal financing for affordable housing, and a number of other things. But what that plan does is try to speed along the pipeline of development for the housing shortage that we're in right now.
You just talked about in the plan, the administration's housing supply action chain, and you talked a little bit about that. Is there any other information you could provide us about that, or give our viewers and our listeners a high level overview of that action plan and more about how it combats the affordable housing shortage?
I talked a little bit about the zoning part of that, kind of incentivizing local changes. A lot of the zoning and land use decisions are local. They're not, there's nothing we can do at the federal level to change, the city and county zoning. But what we can do is incentivize it in different ways. So we're looking at ways to do that. We're also looking at the kind of simplifying some of the financing mechanisms. The other things we're doing are really trying to work with the private sector on construction, on speeding things up, and trying to create the most new homes that we've seen in this country since 2006. So that some of that work is larger than homelessness. We're talking about Fannie Mae and Freddie Mac and HUD decisions and others, but that's some of the stuff that we're trying to make happen at the national level.
That's helpful. I know, when we talk about the affordable housing or just the housing shortage altogether, as many of our viewers and listeners have heard us talk about, we're talking about deeply affordable housing. We're talking about affordable housing. We're talking about workforce housing. We're talking about housing across the income spectrum, really to meet the demand and the needs of individuals across that income spectrum. We talked a little bit about racism and homelessness and racial equity, but we're going to lean in the next couple of questions around it specifically. The All-In Plan does build on President Biden's executive order on advancing racial equity. Tell us a little bit about that executive order and how is it playing out in the homelessness arena? Perhaps that's why there is more of a focus in this All-In Plan around equity and racial equity. But can you tell us a little bit more about that?
Sure. On his first day in office in January 2021, President Biden signed quite a few executive orders, but there were two that I think are relevant to this question. One was a diversity, equity, inclusion, and accessibility executive order that's really pointed at how our agencies function in the federal government. So we're doing a lot internally just to kind of get our house in order around diversity, equity, and inclusion. And then a racial equity order that charged us with creating a racial equity action plan to govern the work of the organization. So we've got that sort of drives a number of activities that we're doing. I would say that kind of came together with what we were already hearing from the field, from something like 600 focus groups that we did, listening sessions around the country that were designed to get input on the federal strategic plan. We were hearing over and over and over the need to include really strong, not just language on racial equity, but strategies to reduce and eliminate racial disparities. So when we released the plan in December of this last year, the work of the executive order and all of the input we were getting from the community really came together to produce that section of the plan and strategies across the entire plan that are imbued with racial equity.
Jeff, we talked about the updates, that every few years there are updates to the federal strategic plan. In what ways does the All-In Plan go further than those previous plans in the areas of equity and anti-racism?
I think many of the previous plans were developed during a time when we as a sector weren't talking about this much. And so they were kind of colorblind in nature, in the sense that here are some strategies, and we're going to focus on veterans, and we're going to focus on families, and weren't, I think, as precise in the description of the problem of the racial disproportionality we see in homelessness, but also even the later ones that did sort of mention that didn't include explicit solutions for how to do that. We've got an entire section of the plan called Lead with Equity that includes things that we're doing at the national level, but also really pushing communities to use that as a roadmap or a blueprint for your own plans. And what we're beginning to see around the country is continuums of care really rethinking their intake and assessment processes, the tools they use, the way they target outreach or do procurement with organizations that are led by and for people of color. There's a range of strategies we're seeing really begin to take root in communities on this. So I think there's what we do at the national level, what the words we put on a page in a plan, what we're trying to do with our 19 agencies. And then there's the question of what you all do at the local level to make all that a reality.
Absolutely. I mean, Rebecca has a big head nod because as the director of our coordinated access system, that, prioritization of clients and match is critically important when we're thinking about those disparities. I turn to that Lead with Equity section in the plan, and I have my notes jotted everywhere. One of those strategies is laid out, and it says promote inclusive decision-making and authentic collaboration. One of the things as an organization, as Housing Forward and a continuum of care that we really focus on is how do we have our lived expertise coalition members at the table? How are we engaging them in really thoughtful and inclusive conversation, not in a way that just checks the box, like, are we talking to people with lived experience or expertise? Check. But really, how are we incorporating their feedback into the work that we're doing? Really quick, simple example is, we're doing some really amazing encampment decommissioning work here locally. So one of the ways that we're literally including the perspective and the voice of people with lived expertise is after an individual is housed, then we're going back to them to talk about the full process. Did this process work? What was it like engaging your street outreach worker? What was it like engaging case managers? What could we have done better for this process, right? And we're able to hear directly from our lived experience partners about how we can improve our process. And then again, not just in a way that checks the box, but really incorporating that feedback into pivoting if we need to. And one of those things was like more options and where to live, right? When you all are giving us options on an apartment or a location, we want more options. And so the work of our landlord engagement team really focuses on providing those options. And if we go, it's a full circle moment, right? Then we go back to affordable housing and where, housing options are around. But I did want to just lift that up specifically around, like, just to bring it to an even more local context. Jeff, we want to talk. Go ahead. I'm sorry.
That's excellent. I'm really, really glad to hear that. We talk a lot about the importance of including people with lived experience, not just as advisors, but actually as decision makers. And we've actively tried to hire people with lived experience onto our staff, and we've got folks on staff, full-time experts. We've also hired consultants to work with us on writing the plan, to work with us on implementing the plan. I think that what you're doing at the local level is exactly what we're hoping to see happen.
Absolutely. And they are paid for their time, just as we bring in any other expert for their feedback. We ensure that they are paid for their time. So I just appreciate, number one, my staff and team that's doing some tremendous work, but also those that take part with that lived expertise to improve our system. I really do appreciate it. A little bit of the conversation we wanted to have today is around the criminalization of homelessness, which, again, your history within this space, I'm sure you've maybe seen an ebb and flow of this, maybe not, maybe it's just been something that's been more recent, but that criminalization we know causes further harm to our unhoused neighbors. What can the federal government do to mitigate such state and local government actions? Can they really do much? But please, if you could illuminate that for us.
Criminalization of homelessness is not new. If you go back to the earliest laws that criminalized homelessness, we're talking like the 1820s in Philadelphia and New York and Boston, the kind of anti-panhandling laws, anti-vagrancy laws, roundups of people who were homeless and locking them into jail and prison, poorhouses, almshouses. Like there's a bad history of this. We do see it ebb and flow though, and it feels like we're in a really dangerous moment right now where the kind of public outrage about homelessness is driving some people, mayors and police departments in communities around the country, to take a more criminalizing approach to addressing homelessness, and it just doesn't work. If you think you can arrest your way or fine or cite your way out of homelessness, it's a fantasy. Those don't work. They're not solutions. And like you said, it even puts up more barriers for people. It can be really harmful to people's health. There's a lot of good research on the fact that multiple displacements over a long period of time can increase risk of fatal overdose, of mental health problems, of physical health problems, as people are disconnected from services and outreach teams and all of that. At the same time, I don't think we have to live with the status quo of forever encampments in our communities. You talked about decommissioning encampments. We've seen a lot of communities do that very humanely and very well, but you do it with a public health and outreach approach, not a law enforcement approach. Law enforcement might be needed if there's real violence happening. I mean, there are dangerous things that happen in encampments, and we need law enforcement to play the role that it plays in keeping everybody in our community safe. But you can't end homelessness by criminalizing it. It's expensive, it's ineffective, and it's inhumane. And yet we're seeing state after state pass legislation that makes it illegal to be homeless. We've seen Texas and Tennessee and Missouri, others like Georgia that are considering some of these bills. They do nothing to solve homelessness and probably make it harder.
Joli, you mentioned this earlier, and Jeff, I know that you touched on it as well. Really, in the plan, repeatedly and clearly underscores the importance of centering and amplifying the voices of our neighbors with lived experience in the planning and the implementation of our system's work. Can we pull on that thread a little bit more and just talk about why that is so important?
If we can connect this for a minute with the conversation about equity as well. And we know that equity is not just the destination, it's also how we get there. And how we get there is in genuine power sharing with people who have been most affected by the tragedy of homelessness, and in particular, people of color and LGBTQ people with disabilities, as well as others. If we continue to make decisions in nonprofit boardrooms, in government offices, without the input of or guidance of or decision-making of people who have experienced the issues we're working on, we're going to keep getting it wrong. In the mental health recovery world, you always hear nothing about us without us, right? Don't make any decisions about us without us in the room, without us at the table. And yet we do it all the time in homelessness. We sit around and make decisions for how we're going to spend continuum of care dollars, how a program is going to be designed, what our approach is to decommissioning an encampment, without actually engaging in conversation with the people who are living in that encampment, or the people who are living in that shelter, or the people who are in that housing program. And I loved what you said earlier, Joli, about paying people for their expertise too. And payment for expertise is more than a bus token and a slice of pizza.
We say it all the time. It's more than just, like you said, a bus ticket or a slice of pizza. It really is compensating individuals for their time. Rebecca, I saw you took yourself off mute. Were you going to say something?
I was just going to say that you talked a little bit about hashtagable moments. You had quite a few of those, and when you were just talking about that, Jeff, especially not just the destination, but the journey in terms of equity. I love that, and the power sharing piece. I think that I got lots of hashtags written down.
Yeah, I try to speak in hashtag as much as I can.
Perfect. You're doing a great job.
Fluent in that.
I mean, but it's critically important, and you're seeing us, if you're watching, you're seeing us like nod our head a lot, because it's things that we talk about regularly. Who's in the room, who's not in the room? Are the right agencies? Are we doing intentional targeted invites so that we have the right people and the right agencies in the room? It is additional work that just has to be done to ensure that we are creating the most effective system that we can, that's really serving the needs of those that need us to be working better. The All-In Plan does mention a coordinated campaign to challenge dehumanizing narratives and combat local opposition to affordable housing development. What could or would that look like? I'll add, like, we've had conversations even from a local level. We just need more assistance from a federal level to help us combat some of these narratives, because literally trying to do the work and combat the narrative around the work is a really tough place to be in. Could you talk about what could or would that coordinated campaign look like potentially?
We're in conversation with a number of the national organizations that are really looking at narrative shift work around homelessness, around housing first, around criminalization, around some of the things we've been talking about today. And I think we're still developing what our strategy will look like on this. In the meantime, we try to use all of the communication vehicles we have, our blogs, our ability to put out guidance, the public speaking that many on our team do, Tamara Wright and her colleagues around the country, myself. When we're in communities, a lot of times groups like Housing Forward will kind of use us in that way, kind of put us to work in speaking with whoever you want us to through community town halls or the media or elected officials. And so I think that's a conversation we can have with you all going forward about how best can we help you shape the narrative locally. But there are some very harmful narratives that are being perpetuated right now around what's working from a policy point of view, or around the sort of inhumanity of people experiencing homelessness. And so what you see that looking like is certainly people taking things into their own hands, like the man on the New York subway train with Jordan Neely, but also a business owner in downtown San Francisco, one of the most so-called progressive cities in the country, spraying a homeless woman with mental illness with a hose to make her move down the sidewalk. Like, where have we gotten to as a nation if we think that's okay? And so I think the narrative work and the public education work is incumbent on all of us who do this. It just needs to be part of what we do and who we are. If you have guidance for us on this one, we'd love to hear from you.
Thank you, Jeff. A phrase that's repeated throughout the plan is targeted universalism. Can you tell us a little bit about what that is and why it's so important?
This is a concept that was developed by Professor John Powell and his colleagues at the Othering and Belonging Institute at Berkeley, and has been applied in a lot of different contexts. The basic idea is that while we would love to solve all of society's problems, we'd love to solve poverty, for example, or racism, and that would essentially eliminate homelessness. But we as a society have not yet made a decision to do that. We've not resourced it. So what do you do in the meantime if you've got resources this big and a problem this big? Now, we want to end homelessness for everyone as quickly as possible, but we can also target those resources in different ways to achieve certain outcomes. And the way you apply that to racial justice work is you say, okay, if there are a whole bunch of folks in a community being evicted, rather than spreading those eviction prevention dollars out sort of in a geographically equal way, you do some zip code analysis and look at where the highest rates of eviction are, and you target resources there to address the kind of hotspots around eviction. Now, if you map that onto a 1930s red line map, it would be the same damn zip codes. So that becomes a targeted strategy. We don't want anybody to be evicted, but we know these areas are experiencing it at much higher rates. We're going to infuse resources into those areas. It also becomes a strategy of moving towards justice. When I talked earlier about targeting prevention resources at inflow points like the point of aging out of foster care or the point of reentry from criminal justice, those could very well be targeted universal ideas of implementing We know that housing and services work for all young people ages 18 to 25, but we know that this group who's aging out of foster care is at particular risk. Let's focus some energy and resources there to try to make the most of the resources we have and begin to put a dent in racial inequities.
Absolutely. I have to, anytime we talk about like those eviction heat maps here locally, I have to talk about, I'm on repeat about an organization here in the Dallas area known as Child Poverty Action Lab. They have wonderful eviction heat map data and information, and they're working with an eviction collaborative with other kind of nonprofits that United Way pulls together regularly around eviction prevention. So to the point that you made, there's a way to be strategic with limited resources and perhaps, a growing need. And one of those ways is even a propensity, like what area has a higher probability of an eviction filing happening based on historical data or redlining data, so on and so forth. So really appreciate you lifting that up. There's a question I want to talk about because it's a little bit in the vein of prevention. And that's the next kind of series of questions that we have. Why is prevention so important? But also, any suggestions on regarding how to champion the scale up housing and supports pillar in a community? Thank you, Dr. Woody, who is a direct service provider in a community where poverty may be ignored as a concept. So, acknowledging the ever increasing kind of inflow, people coming to the front doors, we call it, of many of our shelter providers. And then, how do we talk about that from a prevention standpoint and champion the scale up housing and supports pillar?
It's a really good question. Let me start with the scale up question. The resources that it takes to really do housing and wraparound healthcare supports, mental health care, drug and alcohol treatment, job programs is pretty expensive stuff, right? And the federal government plays a huge role in this. And if you look at what we're trying to propose in the president's budget this time around, it's an increase in vouchers, it's an increase in eviction prevention money, it's an increase in a number of homeless programs, including the PATH program that does mental health outreach, the Healthcare for the Homeless program. So part of this is about advocacy. Part of it's raising your voice to your elected officials in Washington, particularly in the House of Representatives right now, wherever they are on the political spectrum, to say, we need those housing resources, we need these programs, because it's just not realistic to think that the faith community or philanthropy is going to be able to fund affordable housing development on the scale needed, or mental health care on the scale needed. These become public resources that are often driven by federal budgets. So that's one thing I would ask of you all, is raise your voice and raise your voice to your elected officials in Washington. Beyond that, I think you can tell the story of what's working, because I think, Rebecca, you said this earlier at the beginning, we see lots and lots of people successfully exiting homelessness. I'm not sure we always do a good enough job telling that story. And so what happens is people out in the general population, in the community, the media, sometimes elected officials, see homelessness and they're like, what we're doing must be failing because there's still homelessness. What they don't see is, no, actually what we're doing is working on outflow. We just haven't paired that with an inflow strategy. And so what they see is ongoing homelessness. What they don't see is that these are different folks than were homeless a year ago and different folks than will be homeless a year from now. And so I think being able to tell that story both quantitatively and qualitatively is really important. And then really being able to start making some progress on the prevention side is the way to round that out.
This is such a timely topic in our community because we are really starting the process of creating this system-wide diversion process and really starting to think about how our system can do that. And even just last week, we had someone come in and talk about housing problem solving. But I would love to hear your thoughts on what housing problem solving is, who can it help, and how can homeless response systems do more of it?
I mean, you probably got more of this last week than I can share with you now, but I think housing problem solving is a range of strategies that are very person-centered. It's about this individual situation. and about targeting resources in a way that's going to solve their crisis, whether that's the danger of becoming newly homeless at a point of kind of entry into the system where you could actually stabilize people where they are by helping pay some rent to family members and things like that, or help with household costs. Those are kind of diversion programs, but is often under the umbrella of housing problem solving. A lot of it's what happens when somebody is engaged in outreach and services, case management, to help navigate, the kind of housing navigation role that we see some communities play, I think is sort of part of that housing problem solving continuum. But I think we're seeing communities try a lot of different things. The point is, get to the person quickly, provide some wraparound supports that help them in an individualized way. What's the most useful tool in this is a flexible funding pool that you can use in all kinds of different ways to help people stay in their housing, return to housing quickly, pay first and last months, or rental arrears, or utilities, things like that. And a lot of times those flexible funding pools can really be seeded by philanthropy. That doesn't have to be big federal dollars. It can be a few foundations kicking in money to create the flexibility to make some of that housing problem solving happen.
I mean, a perfect opportunity to also locally just say thank you to all of those folks that have supported our Flex Fund, which we have, right? To the point that you said, the federal dollars, local government dollars usually have all of the other strings attached, what it can be used for, what it can't be used for. But the flexible dollars truly allow us to pay those rental arrears. Is it a utility deposit? Is it work boots that you need? Is it a car repair? Like case managers really working alongside an individual to see what those financial barriers may be for them to get housing. So that has been extremely helpful for our community, which I really appreciate. I want to just we've talked about the pandemic a little bit. We've talked about the role that faith-based organizations and the role that they've played and can continue to play in our homeless response system. So I know we had that, but I don't want to, backtrack to that. I do want to ask one of the questions that Daniel Roby, another one of our amazing shelter providers here locally, talks about is recovery housing. It's sometimes an area of debate on whether it meets Housing First guidelines or not. How does USICH look at recovery housing as part of the overall system of care in light of this strategic plan?
Yeah, Daniel, I was really excited to see that question come through in the chat or in the Q&A and hoping we would get to it. I am a firm believer in recovery housing. I think it's got to be part of the spectrum of options that we're offering people. Some people need and want a housing situation that allows them to keep drinking or keep using. And a lot of people need sober housing, need the stability of a recovery environment around them to be able to address a substance use disorder. And I've just seen so much success with recovery housing. And so I think, we're looking at how that can be part of a continuum of housing options, along with low barrier housing first kinds of models. I think this is a both and answer, not an either or answer.
I love a good both and approach. Let me just say, I use it all the time. The all-in plan is federal, but it does set a roadmap for all levels of government. How can local governments and communities best utilize the plan? So I'm going to back up. So when we talked about this next hard conversation, we really wanted to help our listeners and viewers understand this federal plan comes out. You're going to read it, maybe not read it, but then a community is maybe going to utilize it as guardrails or to help them drive some strategy. And that is on the part of local governments as well. So again, this really does provide a great roadmap. And how can local governments and communities best utilize it?
I'll give you a really great example. I heard a couple of weeks ago, I met with in Washington, D.C. with a contingent from Sacramento, California, from the Sacramento metro area and the surrounding communities. And they have recently launched All in Sacramento and created a plan that's very much modeled on the federal plan, but has actions that can be taken at a local level. So that is a very sweet alignment. I love seeing that kind of thing. And so if that's useful to you all as you go forward, that's one way communities do this. Another is to kind of hold up their existing strategies, plans, goals next to the federal plan and just sort of see where the points of connection and overlap are. Are there revisions we need to make to our local efforts to get more in line with this? Equity and prevention might be two good examples of that, but there could be others as well. And then I think that the third is just reach out to our team. The reason Tamara and her colleagues on our national team are here is to support communities in implementing the strategies we're trying to promote at the national level, and then share with her and with our team what you're seeing and learning so that we can then take that back to the White House and to HUD and to HHS and VA and others. So it becomes a kind of two-way communication street.
We've talked a little bit today about some of the work that we're doing here in Dallas and Collin counties. We're very proud of the success we're seeing in our homeless service system led by Housing Forward and the All Neighbors Coalition. And we know from discussions with USICH that our local work has potentially caught the eye of you and your colleagues. Is there an effort with USICH to connect in deeper ways with local communities that are seeing success and help scale some of the things that we can learn from those communities?
Absolutely. And we're eager to share the lessons of your successes and share those across the country. The work that Housing Forward and the All Neighbors Coalition are doing are great examples of how cities are innovating and tailoring their solutions. A couple things caught my attention in this conversation. One was the work you're doing around racial equity. If there are real successes there, because I think we launched the Spark work in, if I'm remembering right, like mid-November 2016. So now we're coming up on 7 years since we started that journey together. But I've been a little bit out of the loop with you for the last 3 or 4 years. So would love to hear, any updates, and especially if there are lessons for other communities. And then your encampment decommissioning work too, if that's being done in a way that is solutions oriented and humane, non-criminalizing, focused on housing, not just sweeps, all of that. We would love to hear those stories because people are constantly asking us who's doing this well. And if you feel like there's something you're doing that has something to teach other communities, please let us know. Send us reports, send us slide decks, send us information, send us links to webinars, and we love to tell those stories.
Will do. Our encampment decommissioning work is a focus on housing. That's what we prioritize and not a punitive consequence. We just talked to Oakland. It might have been yesterday or the day before yesterday. So we do an encampment decommissioning kind of slide deck and conversation with many of our partners. So we'll be sure to share that with you as well, Jeff, and just the work that we continue to do around racial equity. I do, Sarah included in the Q&A a really great question that there's a tension sometimes in between the prevention space, like either poverty prevention or those that are working, those nonprofits that are working to alleviate and end poverty, and then the homelessness system. Sometimes the two are not the same, or the two are not aligned, or they're not swimming in the same pool. How does this plan or USICH envision collaboration among those service providers?
When I read Sarah's question as it came in, and it says historically homeless prevention and homeless recovery systems have operated separately. I would argue that we don't even have a homeless prevention system. We've got a lot of other systems that touch up against homelessness, might see people exit those systems and become homeless, but I don't think there's a coherent system. Now, some communities have done pretty good work around the diversion space, which is somebody calls the shelter and says, I need a place to stay. And you say, what's your situation? And here, can we do something to stabilize what you're doing? I wouldn't call that a system. And I certainly wouldn't say that it's upstream enough. It's sort of still at the moment of crisis. What I would love to see is the development of cross-system, cross-agency homelessness prevention efforts that are coordinated with the homeless emergency response system, but not led by the homelessness response system. Because by the time people get to the homelessness emergency system, shelters and healthcare for the homeless projects and all of the emergency supports we have, it's already too late for prevention. And by the way, that staff is spread too thin already, and there aren't enough resources, and people are burned out and leaving their jobs, and we have high turnover rates, and we cannot expect that group of people doing the emergency work to also go upstream and solve it from happening in the first place. And you certainly can't do it with the same resources. So what we don't want to see is a movement of people and money from the emergency response system upstream into prevention. What we'd like to see is new investments in prevention and new engagement with all of those other systems, whether it's active duty military through the Department of Defense, jails and prisons, which are often run by either city, county, or state corrections departments, healthcare systems, educational systems, child welfare, all of the groups that are touching people's lives before they become homeless. We want them to own homelessness prevention as an outcome that we share with the homelessness response system, but isn't driven solely by the homelessness response system.
Very, very, very well said. Thank you. This has been a truly wonderful conversation, Jeff. I appreciate you joining us. We have learned so much. We've already covered several of the questions from the audience, so I appreciate you answering those as well. I do have to send a special thank you to my most amazing co-host, the hostess with the mostest, maybe, can I say that? Rebecca Hickom, who's a part of our amazing team. Rebecca, thank you for your leadership here at Housing Forward.
Thanks, Joli. Jeff, thank you so much for having this conversation with us and for your work with USICH.
Thank you, Rebecca. It's been great to be with you both.
For everyone out there, our next hard conversation will be in September. Stay tuned for those details to come. Visit our website to find out how you can join the 3 sponsors that are sponsoring our current 2023 Hard Conversation series. Thank you all for joining us today. It takes all of us to end homelessness. We are all neighbors, no matter your address, and we invite you to look for ways to volunteer, to advocate, as you heard Jeff mention, and give toward this work in your community today. Thank you all for joining us, and we will see you next time. Have a good one.